All right, we're streaming live on YouTube now. My name is Lauren Adams with the City of Lubbock Communications and Public Engagement Department. I'm here today with Catherine Wells, the Director of Lubbock Public Health, and Dr. Ron Cook with Texas Tech Health Science Center, who is our local health authority. We're going to start with a brief update on the outbreak, and then we're going to open the floor for media questions. I'm going to go based on attendees who raised their hand in the Zoom, and I'll go in order of when I see hands raised, and then you'll be muted following your question. So I'm going to go ahead and pass it to Catherine.
Well, good morning, everyone. Thank you for joining us today. Dr. Cook and I really just wanted to take a couple of moments to update the community on what's going on in the ground for our measles outbreak. Lots of national media attention around this, but really wanted to be able to answer some questions about what's going on and really just help our community understand the impact of this locally. As of this morning, we're announcing that we've had 146 cases associated with this outbreak that is covering all of West Texas and even into New Mexico now. We have 2 confirmed cases in Lubbock County. And then unfortunately, we also announced the death of a school-aged child this week that is a resident that died in Lubbock, but is a resident of another county. Measles is highly, highly contagious. And the most important thing for our community to understand is that most of us aren't really going to be impacted by this. Over, probably 90% of our community is vaccinated. The messaging around measles needs to go out to those who are unvaccinated, really encouraging them to come and get the vaccine prior to any type of exposure. There are risks in our community and the surrounding communities, and I don't want to scare individuals, but I also want to make sure that they understand that measles is here and it is a risk. And really the vaccine is our best defense from that. And with that, I will turn it over to Dr. Cook that's going to give us some more info.
Thank you, Catherine. I appreciate that. What I want to do is kind of go over what the clinical presentation of measles is, and then who doesn't need a vaccine. So the presentation of measles, you don't know if you've been exposed many times because unless you see or are around an individual that may have the rash. Unfortunately, you should never put yourself in that situation, and that individual should be at home in isolation. But the incubation period is anywhere from 7 to 14 days. And then the next phase we call the prodromal phase. It's the classic 3 C's. So it's the cough, coryza, which means runny nose, and then conjunctivitis, inflammation of the sclera, or the white part of the eyes. Also a very high fever, 103, 104, and that's very typical about what we're seeing. And then you may start off with little sore spots in the mouth. We call those Koplik spots. Little sore spots in the mouth, but then it grows and starts at a rash, and then that rash starts at the top of the head and works its way down. It's what we call a fine maculopapular rash. It's red and blotchy and it has parts of it are raised a little bit. You are infectious. You are infectious from 4 days before that rash starts until 4 days after the rash begins. And we start after the rash begins at day 0. So really 5 days. So you're infectious during that time. And so that's when we want you to make sure that you stay home. If you've been exposed, please stay home. If you're not sure, please stay home and get tested. If you have any symptoms, please get tested. Please call your primary care provider first. Do not show up in their waiting room because now you've potentially exposed everybody else. And then it takes another 10 days to finally get over the disease. Most people who get this probably will do well, but some individuals, as you know, we've had a number of individuals already hospitalized, and unfortunately, we've had one pass away from the severity of this disease. It can cause long-term effects. Most of the time, it's a pneumonia. You get what we call a viral pneumonitis or infection in the lungs. That can turn then into a secondary bacterial infections. And unfortunately, all we can do is support. You know, we have Tamiflu for if you get the flu to shorten the disease. If you get COVID, we have Paxlovid that may help shorten the disease. We have no antiviral for this disease. So it's what we call supportive care. We give you IV fluids if you're dehydrated. We give you medicines to lower your fever. And then we give you antibiotics if you develop a bacterial pneumonia. There are some severe outcomes like pneumonia or death. There's encephalitis or inflammation of the brain. That's about 1 in 1,000 cases. Even more rare, but it can happen and associated with this years down the road after you develop measles, you could get what's called subacute sclerosing panencephalitis, which is fatal. That's a known side effect of having this measles. What I want you to hear is it's not good to go have measles parties, because what may happen is we can't predict who's going to do poorly with measles, be hospitalized, but potentially get pneumonia or encephalitis and or pass away from this. So that's a foolish idea to go have measles party. The best thing to do is make sure that you're well vaccinated. The first dose of vaccine is at 1 year old, 12 to 15 months. The second dose of vaccine is at 4 to 6 years. This is a very, very safe. Millions of doses of this drug have been given. It is absolutely not associated with autism. That's been disproven, and that should have never been started, or that kind of conversation should have never occurred. Finally, I want to go over who does not need vaccination. Well, those individuals that have a documented vaccination schedule. If you've had 2 doses, you're probably good, especially since you had a dose from the 80s on, or 2 doses from the 80s on. If you have laboratory evidence that you've been immunized, we can do blood tests to look for a level of rubeola. This is different than rubella that we certainly don't want you to get during pregnancy, but this is rubeola. You can talk to your primary care provider and do a blood test to see if you are immune to this virus. If you were born before 1957, 98% chance you've already had the measles. I'm pretty sure I had the measles growing up, but as a result, if you're born before 1957, you've probably had the measles. And then if you have a confirmed history, if your provider said, oh, this is classic measles, you've got the measles by a healthcare provider. So those are the people that probably don't need it. Now, if you're concerned, please talk to your primary care provider and see if you need to have a blood titer done or just be given an additional dose of MMR. If you've been pregnant in the last, at least as long as I've been practicing for 30 plus years, if you've been pregnant, you've been tested for rubella, which is not this virus, but the way you become immune to rubella is we give you the MMR vaccine. And that MMR vaccine is measles, mumps, and rubella. This is the measles. So chances are, we check your rubella titer at pregnancy, and if you don't need a vaccine for rubella, you probably don't need a vaccine for rubeola or this measles. So those are the people that have already been vaccinated or may have immunity and should ease your mind. And as Catherine said, let me reiterate, most of our population around here in Lubbock has been vaccinated. There are a few, there are children under the age of 1 that have not been vaccinated, not eligible. If you've been exposed, we do say that we can immunize you from 6 months on, not lower than 6 months. And then our immunocompromised people are also at risk. Those people who are taking immunosuppressant drugs that can't take a live vaccine, and those who are take immunosuppressants for an organ transplant, those sorts of individuals. That concludes what I'm going to say. I'm happy to answer questions, and we'll start the question and answer session.
Okay, and we're going to start with Michael Board. Michael, I'm going to unmute you.
Thank you for being available to us reporters who are covering this growing case. This question is for Ms. Wells. I'd like to talk to you. I'd like to ask you about the origins of this current vaccine, this current measles outbreak. Can you tell me how this is being tracked to the origin and the importance of tracking down how measles made its way to West Texas?
We don't have an answer yet for how the measles entered this specific community in West Texas. We do know from other research, for instance, there was a measles outbreak in an Amish community in, I believe it was Minnesota. That one came from individuals going and doing a missionary trip in Asia and bringing measles back to a community. So it's probably around some type of travel, but we are not going to have an answer anytime soon.
If I could ask a follow-up to that question, I'm sure you've seen the rumors that this outbreak may be linked to undocumented migrants who are doing farm work in Texas. Is that something that is being explored as part of the research into the origins of this measles outbreak?
We're going to go and look at the genetic sequencing to see kind of what other pockets of measles outbreaks there might be a match to. Most measles outbreaks come from somebody, a U.S. citizen or somebody traveling out of the country and bringing it back in.
All right, Erica Edwards, I'm going to allow you to talk now.
Okay, can you hear me okay?
Yes.
Awesome. Thank you guys so much for doing this. It's so helpful. I have two quick questions. The CDC issued a statement last night on this outbreak, suggesting at one point that vitamin A might be an appropriate treatment. And I'm curious whether physicians in your area are in fact using vitamin A at all in this outbreak. Would love to get your thoughts on that. And then also just quickly, Catherine, I may have misheard you at the top. Has the New Mexico outbreak officially been linked with cases in your area? Thank you, guys.
I'll go ahead and start your second question. I probably misspoke on that. I don't know if they've actually made an official link. There is, I mean, the border of Gaines County where this is starting butts up to that other, to New Mexico. So I suspect at some point we will be making that type of link. I'll let Dr. Cook answer on the vitamin A.
Hi, Erica. Yes. So those studies were done in the early 90s that showed vitamin A may shorten the course of those individuals who are acutely and very ill. Not for everybody. You know, most people have normal vitamin A levels, and we're not in a third world country. Most people are nutritionally complete if they eat a regular diet. And so there are problems if people, and you can easily overdose on vitamin A. There are plenty of cases of toxicity. And so unfortunately, vitamin A is also a fat soluble vitamin, so it stays in your system. We just can't pee it off. It's not a water soluble vitamin, it's a fat soluble. So when you give those big doses, that could cause lots of problems. And we need to save that for those individuals and let the healthcare providers in the hospital that are taking care of those individuals deem whether or not it's necessary or not to treat measles. Vitamin A is not a benign substance.
All right, next up is Beth Mole. Go ahead, Beth.
Hi, can you hear me?
Yes.
Yes.
Great. Thank you so much again for doing this. I really appreciate it, and thanks for taking my question. So I just wanted to ask about the sort of responses that you've gotten locally in sort of a two-pronged question. Dr. Cook, you mentioned measles parties. Is that something you're hearing about? And then also on the other side, have you seen sort of responses of people that were maybe vaccine hesitant before coming in to get their children vaccinated after seeing this outbreak and the effects that it's had?
Let me answer the first one. That's mostly been about the measles parties, been social media talk.
Okay.
You know, historically that, you know, we used to talk about, I'm old enough before measles vaccine really came out in full. It did come out in the 60s. And then chickenpox vaccine, they were talking chickenpox parties, those sorts of things. My parents didn't participate in those. I've only seen really talk about those things on social media. Let me discourage you from doing that. That is not a good, yeah, will it afford you immunity if you live through the measles? And most people will, but you're going to be pretty sick. And whoever's taking care of you is going to be out of work for uh, at least a couple of weeks, if not longer. And then the risk, if that's like, it's just too risky. We don't get to pick and choose who's going to do well and not do well when you become severely ill. And I certainly don't want my family to do that. And I recommend what I would push upon my family members. Please don't do that. That's just foolishness. It's playing roulette.
And I think, Beth, your other question was on vaccine uptake.
Yes, that's it.
Okay, all right. So we are seeing an increase in our vaccination numbers here locally. Yesterday, our clinic vaccinated over 50 children, and actually 11 of them had a previous exemption. So that means the parents went through the Texas process to have the child be able to attend school without that vaccination. And we're seeing those parents coming in and providing that vaccine, which is a really good sign. That means our messaging is getting out there.
All right, next up is Juliana Washburn. Juliana, go ahead.
Hello, can you hear me?
Yes, Juliana.
All right, great. Thank you so much for being here this morning. I have two quick questions. Dr. Cook talked about, parents with children too young to get vaccinated, and then also maybe people taking immunosuppressants. So, what can those parents do to protect their infants, or what can people do to protect themselves who might be taking immunosuppressants in the meantime?
Well, fortunately, the outbreak, we've had two exposures here in Lubbock, two related cases related to exposure. There's not a lot of it, and most people are well and immune. I would say if you are high risk, be careful where you take that individual, and just be careful that you don't get in large crowds or places where you could be exposed. It's highly contagious. It is, if not the second most contagious virus that we know about. Polio is almost the same, maybe a little bit higher. And we know how devastating polio was, but be deathly afraid of that and other viruses. And so, and measles is so infectious that if you have somebody that's potentially very susceptible to that, just be careful where you take them.
All right, next up is Nicole Villalpando. Nicole, go ahead and ask your question.
Sure, thank you. I am wondering about those kids who are 6 months to a year who cannot be vaccinated yet. Is there any recommendation about going ahead and vaccinating them in counties where there is serious uptake of virus?
Certainly, Nicole, that's a great question. And chances are, well, we can vaccinate a 6-month to 12-month-old early, especially if they're exposed. The threshold for lowering that mark is much lower, especially in those communities where there's lots of disease. So if you have a 6-month-old, I would to 12-month-old certainly would recommend you go ahead and take an early vaccination. The caveat there is you still need 2 more doses. That child still needs 2 more doses past the one you give them for for prophylaxis. And it has to be at least 28 days in between those two. So they're going to have 3 doses to be fully vaccinated. An infant under the age of 12 months just doesn't have the ability to elicit an immune response that somebody over the age of 1 year old, their immune system is fully intact. And so that's why we're saying go ahead, you can give it, but you still need the 2 other doses. For less than 6 months, we don't recommend it's not really, we don't recommend giving a vaccine. If you do get exposed and you're under 6 months of age, we can give you immunoglobulin to help fight off the infection.
All right. Next up is Karen McKay. Karen, go ahead.
Karen.
Karen, do you want to unmute your mic?
Hi, thank you. We had a comment yesterday from Texas Children's Hospital that they expect there could be several hundred cases before this is over. Is that what you were expecting also? Is your thoughts on that?
I mean, this outbreak is going to continue to grow. We have susceptible individuals and multiple measles cases. I don't have the data or the forecasting to know how large it will grow, but I do expect it to continue to see additional cases.
All right. Next up is Eduardo Cuevas. Go ahead.
Hi, thank you. Can you hear me?
Yes.
Okay, thank you. Yeah, wanted to check if you can go over the types of hospitalizations we've seen, statuses of patients or symptoms that landed them in the hospital. And then I had a follow-up after that.
Sure, Eduardo. That's hard to say exactly. Most of them are either severely dehydrated from just the infection itself and or lots of low oxygen levels, hypoxia. That's from the inflammation in the lungs. And remember, our children, their airways are not as large as an adult's airways. So a little bit of inflammation, and there's a lot of inflammation that occurs in the lungs. It starts out with this viral pneumonitis, which is an infection from the virus. And the inflammation, itis means inflammation. And so, but then it can turn around and develop into bacterial infection after that. And so most of these kids can be volume depleted and or their oxygen levels are so low that they require supplemental oxygen and or intubation and ventilator support. And then we're giving them antibiotics to help fight off bacterial infections, even though this started out as a virus.
And just as a follow-up, Dr. Cook, I was wondering if you could talk more about presentations of measles and how are you recommending clinicians look for signs in patients and thinking about around the country? Are there steps providers should think about, particularly if they've never seen measles before?
Well, we're taught about all kinds of infectious diseases in our training, and so, but this is kind of textbook in the way it's presenting it. High fevers, and then the 3 C's: the cough, coryza, and conjunctivitis. The cough, lots of chest congestion. That's the inflammation in the lungs. Coryza is the runny nose, so lots of runny nose. Conjunctivitis, red and inflamed and runny eyes, and then at some point you may develop the complex or the sores in the mouth. That's just where the virus is beginning, and then it spreads into the lungs and to the rest of the body, and that's when we get the rash. But you are infectious, and please, and most providers know this, please call your provider and tell them you think you may have the measles. We want to take care of you, but we don't want you in our waiting rooms infecting everybody else that's at risk.
All right. Next is Christy Martinez Garcia. Christy, you are good to go.
Good morning, everybody. My name is Christy Martinez with Latino Lubbock Magazine, and I just want to ask, there still seems to be an increase in vaccine hesitancy, and the perception remains that it's unsafe. And on a national level, where we don't seem to be getting the type of interest, even the CDC is only updating its website once a week. And I think that they didn't even update that a child had passed. How often will you update your different media or outlets? And also, what are you doing? Because I know that only 80% of the children in Gaines County have been vaccinated, that is. What are you doing to help propel that type of interest in our community as well as in the partnership with Gaines County?
Do you want me to go ahead and start that?
Yeah.
Okay. So our data, or because this is a multi-jurisdictional outbreak, the numbers and case counts will be updated on Tuesdays and Fridays. Because all of these individuals live in different counties, we have to roll that up at the state level and get that information out. With Gaines County and even in Lubbock, we are working with our state partners to add additional access to vaccination. They're actually doing additional testing, access to testing in some of the rural counties. So it's about bringing teams of nurses into different communities to really encourage vaccination. There is also going to be information released, some PSAs, some other work around increasing vaccination rates in this whole general community.
All right. Up next is Samantha Larned.
Hi, thank you. We're seeing a majority of these cases in more rural counties. Here in Lubbock, I believe we've only had 2 confirmed cases. As measles makes its way into more densely populated cities and communities, would you expect to see an uptick in cases in that area, or does it tend to fizzle out because of the herd immunity?
Go, Dr. Cook.
Well, so herd immunity is great, right? That's what we want for protection. Unfortunately, with measles, it's so infectious that if you don't have a 98% 98% vaccine uptake and all the individuals in the herd, measles is so infectious, it'll find those other 2 people and give it to them. So the thing here is to make sure your community is as vaccinated as it can be. And yes, we are. We're really encouraging people to make sure they're updated on their vaccine schedule. That's the biggest problem. And so yes, do we expect our numbers to pick up? Yes. I don't think it's going to be, it's not a huge wildfire, but it's going to be a smoldering and grass fire or tumbleweed fire for a while until we finally get it stomped and put out. But I do expect our numbers to pick up.
All right. There are a couple follow-up questions, starting with Erica Edwards. Erica, I'm going to let you unmute.
Actually, I think this sort of dovetails on what another reporter asked earlier, related to how doctors can be identifying measles. And it occurred to me that, we're all using pictures of this rash that are sometimes decades old for obvious reasons. I'm wondering if you have any new photos that can really illustrate what this rash looks like.
I don't. Maybe the healthcare providers in the hospital may have some more recent photos. We have to be really careful about taking pictures of patients in those photos and making sure we don't violate HIPAA, those sorts of things. But the photos, you got to be careful with internet searches for pictures of rashes and stuff. It may completely present the wrong looking rash. And unfortunately, rashes do have some variation in how bright they are or how subtle they are. But it's, we go not only on the picture of the rash, but a rash by historically for measles starts on the head and works its way down. And so that's sort of textbook, and that's what we're seeing. And then our fellow friends and citizens that are of color, sometimes the darker the skin may present a little bit differently. So you really have to pay attention and get the history and then look closely at the rash. Okay.
Karen?
Yes, are you there? Can you hear me?
Yeah, we
That's
hear you.
Karen.
If the MMR needs 2 weeks to build immunity, what does one dose do if you go in? I mean, how soon do you have a gradual protection, or you really are not protected at all for the 2 weeks?
Well, so one dose it affords you after a couple of weeks about 93% immunity, and that's why we want you to have a second dose at least 28 days after that initial dose. And so it'll afford you 98% immunity. It just takes a while. Our immune system takes, a couple of weeks to really respond and elicit the appropriate immune response to the vaccine when it's given. So you're still vulnerable for a couple of weeks.
Right, Teddy Rosenbluth, I'm gonna have you go next.
Hey there, can you guys hear me okay?
Hi,
Yes.
Teddy.
Okay, hey. I wondered whether there was any talk of taking more forceful measures to stop the outbreak, like, enforcing quarantine or mandating vaccines or keeping, unvaccinated kids out of school before they're exposed.
Well, that's difficult. We can do that. Our best goal long term. And we learned lots of lessons during COVID, right? So we have to be careful. We want those who need to be quarantined to comply and or in isolation. But we can't force anybody to take a drug. That's assault, and we just can't do that. We're better off if we go into the community and try to educate and build trust and have conversations with individual leaders, the father figures, the mother figures, the city dignitaries in those communities, community dignitaries, and really try to build trust. That works better. And so that's exactly what we're doing. We're offering free vaccine. We're offering free testing in those communities with the highest case counts right now.
And I'll add that the vaccine's free in Lubbock, and even among some of those surrounding counties also. So we're trying to reduce every barrier possible to get the vaccination.
Thank you, guys.
Eduardo Cuevas, I'm gonna ask you to unmute.
Thank you. Yes, just another follow-up. I was curious if you could walk through how y'all are seeing vaccine hesitancy in communities, whether that's in Gaines or in Lubbock proper, versus under vaccination or folks maybe not going and getting the immunizations for themselves or their kids, and how are you talking to folks about getting vaccine?
I mean, I think we're talking to everybody pretty much the same. When someone comes in to the health department, we're really just wanting to welcome them there, give them information about the vaccine, and encourage them to come and get it. We're just trying to combat some of the misinformation that's out there, and really getting the messages from our physicians and our hospitals and public health into the community through trusted messengers, through healthcare providers, to really try to get as much vaccine into arms as we can.
Right. Juliana Washburn, I'm gonna ask you to unmute.
Hello, can you hear me okay?
Yes.
Okay, I was just wondering, is there any concern for local schools and daycares when it comes to exposures?
Yeah, I mean, that's a big concern for us. We are working closely with our schools. As we were starting to see cases out in Gaines County, I sent out information to all the schools about the outbreak and what they might need to send information about the outbreak, and encouraging them to identify unvaccinated students in their communities. I sent a letter to parents. So we want to we don't want to allow, I'm very nervous about getting a vaccine case or a measles case in a school or a daycare, but we are closely monitoring that.
Okay, Up next is Christy Martinez Garcia again, and I'm also going to ask for Julio to join us. I believe Christy Martinez Garcia has a question that she would like responded to in Spanish. We have a translator here on hand. Go ahead.
Thank you. First, I'm going to ask, or in English, but no doubt, folks, that COVID prepared you for combating and controlling the measles outbreak. But at that same token, much like COVID, it's unfortunate that measles have been related to undocumented immigrants. And that being the case, are you preparing, because it was said that this was coming from Mexico, and but are you preparing to make sure that folks that are undocumented or that do not speak English have the proper information? Are you working on that? I'm sure that you are, but I just want to confirm that. Also, if I need to ask in Spanish, I'll be more than glad to ask this question in Spanish, but just let me know how you would like for me to do that.
I mean, I'll answer first in English, and then Jesus, our translator, can probably, if you want to do that in Spanish. Our goal with any communicable disease is to work with everybody in our community. And we need to encourage vaccination of the entire community. And I don't know how to say that. I mean, I'm just trying to say that over and over again. We are working to get information in Spanish and English. And then also, because a lot of this is impacting the Mennonite community, we're also putting things out in Low German. So we're trying to be really understand, culturally sensitive to every group that could be impacted by this.
And just real quickly, do you believe that any of I know that the DEI is impacting state and national issues. Does this put any pressure on you locally?
I mean, measles is a a disease or a virus that we've been combating for 50 years. The goal is to vaccinate everybody, regardless of their race, ethnicity, any of those terms that we like to use to categorize people. This is a community issue.
Thank you so much, Catherine.
Christy, we are unbiased. We want.
Oh, I see that. Yes, I know that from the COVID experience. So I just want to ask, because there have been some concerns from folks in that, specifically that felt attacked by the political rhetoric. And so I just want to make sure that that information will be readily available, not just for those communities, but also for media, because, we're here to help in sharing that information.
Thank you for sharing, Christy. Appreciate that.
Jesus, would you please convey that in Spanish as well?
Yes. Bueno, para la primera pregunta, estamos trabajando con la comunidad que habla español para distribuir toda la información necesaria para las vacunaciones. Igual, como Christy dijo, que hay un estigma que el sarampión vino de México y de estas comunidades que no son, quien dice, americanas. Entonces, ¿cómo podemos prevenir esa misinformación? Entonces, es trabajar con las comunidades, igual trabajando con la comunidad menonita, porque igual ellos están en esa misma estigma. Entonces, estamos trabajando para tener información en inglés, español, igual en alemán. And I'm sorry, Christy, what was the second question?
La otra pregunta es solamente que si van a tener la información para proveer a la comunidad que nomás habla en español.
Sí, sí, en eso estamos trabajando, estamos trabajando en teniendo toda la información en español e inglés igual, en alemán, para que todos tengan la información correcta y necesaria para vacunarse y, bueno, tomar esa decisión que ellos piensan deben de tener.
Gracias.
Sí.
Thank you, guys. And then we have one more follow-up from Karen McKay. Karen, I have just asked you to unmute.
If you're around another child, say when you were growing up who had measles, but you never got it, does that mean that you have some sort of a natural immunity to that? Could that be possible? I've heard a lot of people tell me that I have a natural immunity.
Karen, maybe. I would not take that to Vegas, nor risk my life on that. If like I said, if you're born before 1957, you have a significant chance of maybe not remembering, but you probably have immunity. However, we can do one of two things. We can either check your level for rubeola titer, which is to see if you have immunity against rubeola, or just go get another vaccine. It's like I said, it's a good drug. And so there are lots of people that have probably healthcare workers have had at least one additional dose. If you've traveled overseas to an area that had endemic measles, it was probably recommended to you that you take another dose of MMR. Like I said, if you were pregnant, you probably had rubella titer checked. But in all that to say, if you're concerned, you have two options. Go ask your primary care provider to do a blood test on you to see if you have immunity, and or just receive another vaccine.
All right. And then our last question is going to be from Michael Board. Michael, I'm gonna
Thank you.
Go ahead.
I'd like to ask you about the federal response to this measles outbreak. President Trump's health secretary was asked about it, and he suggested that measles outbreaks happen often. Is there something that you would like to see from the federal government that you would think that you think would be able to help slow or stop or track this measles outbreak?
You're muted, Catherine.
As a local health department official, all of our requests are funneled through the Department of State Health Services. And if they're unable to meet one of those requests, they can choose to try to access federal resources.
All right. And then that'll conclude our meeting today. Turn that off. Okay. So if anybody on this Zoom right now would like to request to be added to our media list, you can email lnobles@mylubbock.us or ladams@mylubbock.us, and we will get you added to our media list for updates regarding anything related to measles right now in the area. And thank you all for being here.